Alrighty. So good evening, everybody. Thank you all for joining us for today's call of Candid Conversations about COVID-19, where we'll be talking with medical professionals from our community, and they will be talking about their experience and expertise on the COVID-19 pandemic, as well as the vaccine. So thank you all for joining us this evening.
Thank you for having us.
Yes, and this is also part of a video series in which is a part of the Mount Pleasant Social Justice Ministry, in which we provide informative and dynamic discussions about achieving social justice and equity for all. So today, my name is Erykah Benson, and I am today's event facilitator for this conversation. I am a current senior at Michigan State University, and I am excited to graduate this semester, and I'm also excited about this new video series and project that I'm taking the lead on as the event facilitator. Thank you. So today's conversation will be focusing on an informational discussion about racial medical disparities and the distribution of the COVID-19 vaccine as one of the newest and most viable ways that we can help slow the spread of this pandemic. I am also joined by several medical professionals from our own community who have donated their time to discuss their expertise on this subject. So today we will be having, the first part of it will be an informational session detailing the current status of the pandemic, coupled with a Q&A session in which we will have a conversation with our guest panelists. Central to this discussion will be the COVID-19 pandemic and the vaccine, as well as the source of mistrust that many Black people feel surrounding the vaccine. So on a nationwide basis, the CDC reports that Black Americans are 1.4 times more likely to contract and be diagnosed with COVID-19, 3.7 times more likely to be hospitalized, and 2.8 times more likely to die of COVID-19. So this bar chart right here, which is pulled from the CDC website yesterday, captures the nationwide cases on the basis of race and ethnicity. However, the important statistic here is actually not on the bar graph itself, but in the subtitle. You can see here that 50% of the cases on the nationwide basis actually don't have data on race and ethnicity, meaning that we're missing half the story here. And recently, the Michigan Department of Health and Human Services also reported last week that 30% of all cases in the state of Michigan fall under the category of not unknown, which means that we don't actually have race and ethnicity data for 30% of those cases either, meaning that we don't have a full picture of how this pandemic has been affecting people on the basis of race and ethnicity. So you can see here the data here. And then next we'll be talking about the historical roots of the medical mistrust that people have of the vaccine. Not everybody, but a lot of people have been hesitant to take the vaccine because of just a sense of mistrust about how the vaccine is going to affect them. So the purpose of this discussion today is to hopefully shed away some of that doubt and that hesitance, because the vaccine is going to be an important part of how to tackle this pandemic. So I have two major historical case studies about why people historically feel so hesitant and distrusting of medical care. The first being Henrietta Lacks. Henrietta Lacks was treated for a tumor at Johns Hopkins Hospital, and her cancerous cells were taken as samples without her consent or knowledge in Johns Hopkins Hospital to treat cervical cancer. Her cells themselves were the first to be immortalized in this fashion, meaning that they were reproduced time and time again to study the effects of drugs, toxins, hormones, and viruses, which have a huge benefit to the scientific community. Lacks passed away at the age of 31, and having not benefited financially or accredited to the cells being hers, hers is a tragic story of what happens when we take advantage of the racial minorities for the advancement of science at their expense. Example number two is really famous, and I'm sure you've heard of it, the Tuskegee syphilis experiment, which started in 1932 and ended in 1972 and was conducted by the U.S. Public Health Service and the CDC. Researchers studied 600 men from Tuskegee, Alabama, 399 of which had syphilis, which the participants referred to as quote unquote bad blood. The core problem with this experiment was that the researchers failed to provide what is called informed consent, meaning, which is something that did not exist back in the day. Informed consent means that the participants fully agree to a research project, knowing what they're going to get into once they enter the project, meaning they're going to know what's going to happen to them. They know that they're allowed to back out of the project if they don't feel safe. There are all these regulations in place today that did not exist during the beginning of this project. And to make things worse, when penicillin became a popular form of treatment for syphilis in the 1940s, the researchers for the Tuskegee syphilis experiment failed to let these participants know that there was a way for them to be treated for syphilis, meaning that there was generations of disease and suffering because of this misinformation. Ultimately, in the 1970s, the families of the men who participated won a $10 million out-of-court settlement with Congress. And former President Bill Clinton issued a national apology for this unethical research. And I want to highlight the impacts of this study because everyone knows the name Tuskegee syphilis experiment, but we really need to talk about what happened after. And what happened after was that people wanted to prevent this from happening again. So nowadays we have things called informed consent. We have this institution called the Institutional Review Board who has to approve research before people are able to conduct it, meaning that they need to make sure that they provide the participants informed consent. The researchers have to make sure that they're not taking advantage of the people they're researching. And so I present these two examples to illustrate that the generational mistrust that a lot of people feel from the medical field comes from a real and horrific historical place, one that continues to this day in the form of racial bias amongst medical professionals. But the purpose of this episode is to not just address the negativity, the horrors, but to also look at the real solutions to survive this pandemic, which right now comes in the form of a vaccine. So beyond Tuskegee, where are we today? Studies show that African Americans are severely underrepresented in clinical trials for medical products, vaccines, and other medical devices. The CDC, I pulled this up from the FDA, it shows that Black people make up 14% of the nation's population, but they only represent 5% of clinical trial participants. So this is very important because we need to understand how vaccines and medicine affects people of the broad spectrum of the national population, not just the majority. And not because of some biological difference based on race, because we know that race in itself is actually just something that we have made up as categories, but because there are certain because of different lifestyles and just and the inequality that comes that is inherent in our nation, that we need to know how this is going to affect people's health. So studies in the past have found that barriers of representation include the differences in income, the investigator bias, meaning that researchers don't do as well of a job of recruiting people of diverse backgrounds, the access to transportation, and then lastly, medical mistrust, which is based on this 2015 study where they interviewed Black research participants, and they asked them, why don't you feel trustful of researchers? And they pointed back to Henrietta Lacks. They pointed back to the Tuskegee syphilis experiment. So there's this historic mistrust, not because they directly experienced it, but because they know that their ancestors and people like them experienced it. So in terms of the disparities of COVID-19 in general, African Americans represent 14% of the state, yet represented 40% of the total COVID-19 deaths between 2020 and 2021. And we know this all too well. We know too many people who have passed away because of this virus, and we want to get rid of it. And I'll say here that we don't even know the full impact of the health disparities because, as I showed you before, we're missing 30% of the race and ethnicity data for COVID-19 cases in this state. So here's on a national scale, we make up 14% of the nation roughly, and we make up 25% of the deaths. And now, before we go into the interview portion of our presentation, we want to show you a news clip from CBS talking about Dr. Kizzmekia Corbett, who is a fundamental who played a fundamental role in developing this vaccine. And she talks a little bit about the Black community in terms of medical mistrust. So let's take a look.
According to the Centers for Disease Control and Prevention, more than 6.5 million Americans have now received their first dose of the vaccine against the coronavirus. It's a number that will be growing every day, though it's well behind what public health experts had been hoping to see. Along with manufacturing and distribution issues, public health officials are concerned about millions of Americans who are resistant to taking the vaccine. To address that, some of those officials are shining a light not just on the science behind the shots, but on the scientists who help bring the vaccines to fruition. When the president paid a visit to the National Institutes of Health last March, the leads at the Vaccine Research Center explained their life-saving mission.
Y-shaped proteins that will bind.
The key to it, a 34-year-old doctor named Kizzmekia Corbett.
I was just there telling the task force about the work that we've been doing.
2 weeks later, Dr. Corbett's team began the first stage of clinical trials.
We have taken a lot of the knowledge that we have gained over the last 6 years and applied it to a fairly revolutionary vaccine platform in collaboration with Moderna.
That vaccine rolled out within 10 months.
The vaccine teaches the body how to fend off a virus because it teaches the body how to look for the virus. By basically just showing the body the spike protein of the virus, the body then says, oh, we've seen this protein before. Let's go fight against it. That's how it works.
For a lot of people, seeing you as the person who is part of this process, there's a trust factor.
To be honest, I didn't realize the level of impact that my visibility might have. I do my work because I love my work.
Dr. Corbett's interest in science began at an early age, but one opportunity made a key difference. She attended the University of Maryland, Baltimore County as a Meyerhoff Scholar, an aggressive program that mentors minorities and women in science. Graduates include Surgeon General Jerome Adams.
Was she someone who's going to make it all along?
She was definitely going to make it in life.
Dr. Freeman Rabowski has been president there for nearly 30 years.
She had strong science background, but she also was very comfortable with people. We need more scientists who can connect to people. She could do that when she was 17 easily. What we do at UMBC is to support students of color, Black, but also students in general, to make sure they make it in science.
Only 18% of all students graduate with a STEM degree, according to the National Center for Education Statistics. Around 2% are Black.
It's important for those people to see people looking like them, like themselves, who can be involved. If it's about women or if it's about Blacks, because it shows that you've got people who understand what you've gone through.
Dr. Corbett and I have worked together for maybe 15 or 16 years, since she was in high school.
Dr. Barney Graham's not only Corbett's mentor, he's her boss.
When you recognize somebody has special qualities, you need to do things that can keep those other things out of the way and avoid some of the dismissiveness that often happens, not only to minority people, but to women.
And historically, that bias strikes not just professionals in the field, but those that they serve.
Let's talk about the impediments to the trust.
I grew up in Birmingham. All of my life, I was hearing about the Tuskegee study.
The federally sanctioned Tuskegee experiment sought to examine the long-term effects of syphilis by letting infected Black men go untreated with no regard to the suffering it caused.
How do you feel about being used as a guinea pig? I thought once it was pretty rough.
Another example, the special cells of Baltimore cancer patient Henrietta Lacks were taken without her explicit permission and were subsequently used in billions of dollars worth of medical research without compensation.
There are many other examples of supposedly objective scientists who were caring about everyone, who valued people of color less. It's a painful truth. And this is what's significant. When I say Kizzmekia Corbett is from a small town in North Carolina, a young woman of faith who understands the socio-cultural issues that we face, who knows what racism means, she gets all of that.
What's your message to people who are hesitant to take this vaccine?
Well, number one is that I get it. Number two is that to really take advantage of the level of transparency that we are attempting, even I haven't even seen before, such as FDA hearings and briefings being broadcast online and data coming out almost instantly.
And to try and address them.
And in one of those webinars,
fully,
Dr. Anthony Fauci gave her a ton of credit.
The vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact. I mean, that is a fact.
A fact offering illumination to those often left in the dark.
She cannot be a hidden figure. She cannot be a hidden figure. She needs to be in textbooks. Little girls need to see her, of all races. This is what's possible.
She's not a hidden figure now.
Yeah, no, she's not. And it's just, it is a testament to the work of Dr. Rabowski and others like Dr. Graham, her boss, who pushed and also moved out barriers in her way.
So she could have that opportunity.
Yeah, and look at all of us benefiting now from it.
I was gonna say, the only way you can undo all those years of damage is to start right now and start moving those to the side, put her in the forefront and try to change minds.
Yeah, and there are others out there just like her, of all races.
Great
We want to
story.
give them all a big round of applause.
Okay, good stuff, Michelle.
All right, so, and I want to stay real quick. The Reverend Liz Walker, who is activist in Roxbury Presbyterian Church in Boston, stated that in an NPR interview last December that we're in a quote unquote perfect storm of distrust because the vaccine has been politicized as well as the pandemic in general. So coupled with that mistrust that we just talked about and referenced in that CBS News special, that of course that our history, the history of racist mistreatment by the healthcare system is something that we need to address in this pandemic and in relation to the distribution of this vaccine. So with that being said, tonight I'd like to welcome our guest panelists who we invited to provide their incredible expertise as medical healthcare professionals. I have created 3 pre-made interview questions, but then I'm going to turn it over to our audience for an open Q&A discussion in which you are more than welcome to comment your questions in the chat via text. And so before I'll do that, I'll introduce our panelists and their titles, but if you'd like afterwards that each person can go and introduce themselves and tell us a little bit about their career. So today we have Sharonda Davis, registered nurse, Dr. Cheryl Gibson Fountain, MD, Dr. Iceline Butler, MD, Gloria Anderson, registered nurse, and Dr. Vincent Knight, MD. So thank you all for joining us today.
Thank you for having us.
Thank you for having me.
Yes. Sharonda Davis, can you please introduce yourself?
I'm Sharonda. I've been a registered nurse for 20 years. I just had my 20th anniversary last month, actually. I've been with Henry Ford Health System the entire time. I started at Henry Ford, Maine, doing trauma surgery, and then I moved on to kidney and liver transplant. Came out here to kind of get, it was a lot downtown. Came out to West Bloomfield, moved out here, and I've been out here since 2009. And I work on the orthopedic unit, which is a little bit different for me. I'm now currently a clinical coordinator for orthopedic surgery. We get a little bit of everything. So I'm right there at the bedside. I'm right there with the COVID patients. So that was a little bit different, but it's been a good experience. And I'm also now in the process of becoming a certified doula. I just started that because I needed it's like a refresh, like something fresh. So I'm doing that just as something light because I need a little break.
I love how you say that's something light when to me, I'm like, that's amazing. That's fantastic. Well, thank you so much. And Dr. Gibson, could you introduce yourself?
Yes, hello. I'm Cheryl Gibson Fountain. I'm actually a practicing obstetrician and gynecologist, born and raised in Detroit. Been practicing for 37 years, and actually Sharonda will be utilizing her doula services for pastors, Brooklyn, soon to be granddaughter, coming out at any time, basically, as we speak. So that's a wonderful blessing. But I've actually been in practice, like I said, for 37 years here in the area, and taking on roles which are actually a blessing because it's allowed me to try to make an impact on women's health and moms, serving as chief of staff of the old Detroit Riverview Hospital for 4 years, and then going on to be the president of the Wayne County Medical Society and then the Michigan State Medical Society. My current role is the American College of Obstetricians and Gynecologists representative to the American Medical Association, where we're actually, make health policy. So that's where we do the health policy for the entire country. In addition, we have had for years Maternal Mortality Surveillance Committee, which has just recently been reorganized. And so I was just appointed to serve on our Michigan Maternal Mortality Review Committee, which actually is our charge is to go over any maternal deaths that have happened within a year of childbirth. But as Erykah was talking about the disparities, the largest amount of maternal deaths happen in African American women, have always happened in African American women. And so that is something that's near and dear to my heart for the past 37 years. And so we are utilizing our committee to actually make an impact on doing things that we can actually address, which is, postpartum hemorrhage, as well as hypertension, to decrease at least 47% of the deaths. So I'm just happy to be here, and just wanted to congratulate Erykah on the manner in which she has put this session together, and her opening was excellent.
Thank you so much. And thank you so much for sharing your extensive career. It's so impressive and just so inspiring. Dr. Butler, could you introduce yourself?
Good evening, everyone. I'm Iceland Butler. My background is in clinical pathology. I am more lab rat per se. I just like and finding out what's wrong. I am that same lady, trying to find a cure for everything, or what we could do better to help our disparaging countries, nations around the world. My background, I've worked globally. Actually, I have worked with Sharonda, but not worked with Sharonda, but we recorded at one time together. But I have worked in the Africas, the Caribbean, South America, and all here in the Americas also, developing laboratory standards and developing like exams and so forth, using the ISO standardization for individuals and different varied countries. I worked with many country governments around the world in order to standardize their country against the others, in terms of whether it's pathology, whether it's helping them develop their core natures for their country and what's best for them. Extensive years in pathology, started at Detroit Receiving Hospital as a so it was exciting for me then, and I found myself back in Detroit some years later, and at Mount Pleasant, and enjoyed all the people there. Good to see you. That's me.
Yes, thank you so much for joining us tonight. And then let's see. Oh, and then I see Sister Gloria Anderson's here tonight. Sister Anderson, could you please introduce yourself? Oh, I think you might be muted.
All right, is that better?
Yes, I can hear you.
Okay, all right, very good. Hello, everybody. Good evening. Hey, Dr. Gibson.
Hello,
Good to see
Gloria.
you.
How are you?
I'm good. I have many years of experience in nursing. I started out at the very beginning. Oh God, I'm not even gonna tell you when, but I started out as a nurse's aide and proceeded upward the ladder from there. I've worked. If it's a department, pretty much I worked it. So I always tell everybody I know what everybody's supposed to be doing because I used to do it too.
Right. Yeah.
um, Went back to school, got my bachelor's, got a master's, and my master's is in organizational management. So when I say I know what everybody's supposed to be doing, I'm not telling a tale. I do know what everybody's
Right.
supposed to be doing.
Exactly.
Worked the intensive care unit. I worked basically intensive care unit or some specialty unit. I worked dialysis, you name it. Like I said, I've done it. I've worked with Dr. Cheryl Gibson for many years at
Yes, many years.
Detroit Riverview Hospital,
Right.
and I had the esteemed pleasure of assisting her on the medical exec board, which
Absolutely,
was
yeah.
eye-opening and a very educational experience for me because I learned so much, which helps me to do what I do today. And today I work as an RN case manager at Beaumont Grosse Pointe Hospital. They call me the lead case manager.
Right.
And I do what I do. I want to make people say I plan for safe discharges to make sure that what everybody else done comes together so that when our patients are discharged, they can go home safely. I serve a multitude of cultures in our facility. So I have to make the adjustment for everybody.
Well, thank you so much for joining us today and sharing your expertise in medical care. And then last but not least, we have Dr. Vincent Knight joining us today. Dr. Knight, could you introduce yourself?
I sure will. Thank you for having me. Can you hear me okay?
Yes.
Okay. It's definitely an honor to be here with such esteemed colleagues. I'm zooming in from Atlanta, where it reached almost 60 degrees today.
Oh,
and
I'm jealous.
Yeah.
Yes, right.
But I'm definitely glad to be here. I am an internal medicine physician. Was raised in the South. Went to medical school at Emory and did my internal medicine training at University of North Carolina at Chapel Hill, which is my home state. And from there, I did venture to the Midwest, to Indiana, and was in the South Bend area for 4 winters doing primary care there. But that last winter, with the lake effect snow, it pushed me
It really got
right back down to the South. So I've been in the North Carolina and Georgia area for the past 20 years. And I've started several hospitalist programs in the Atlanta area. And I've also done some outpatient medicine as well. Currently, I contract with the Center for Disease Control and Prevention. And I'm a part of their deployment assessment and monitoring team. And as a part of that team, I help to care for CDC staff, employees who have contracted coronavirus and those with symptom complexes that are similar to coronavirus. So help to screen them, get them the care that they need so that they can continue to care for the nation and the world. So I've been doing that since April, and definitely glad to be doing my part, actually in a very safe environment because I do mostly telemedicine. But I'm definitely glad to be a part of this panel, and hopefully we'll be able to advocate strongly for us doing what we need to do to be healthy, to prevent coronavirus, to get vaccinated, and to practice all the safety precautions that we need to be doing to stay healthy and be healthy.
Yes, absolutely. Thank you so much for joining us tonight, Dr. Knight. And then we actually have one more guest panelist today, Sister Sheila McKee, who's a registered nurse. If you could introduce yourself.
No, I'm not actually a registered
Oh,
nurse.
I'm sorry.
I'm just a nurse at Mount Pleasant Missionary
Okay.
Baptist Church.
Well,
Yeah.
that's very important.
Yes, it is.
Yes.
The funny thing is, I just started back to school for medical administration. So this is a good thing for me right here.
Right.
Well, that's good. That's great. Okay, so let me turn back over to the presentation. Can everybody see this okay?
Yes.
Okay, perfect. So my first question to you all is, how does, this is related to the history we just discussed in the previous slides, but how does the historical racial trauma of the healthcare system impact the way you personally see medicine as a profession today? And anybody can jump in. We kind of just make this a conversation.
I struggled with this question, so I'm eager to see what other people have to say. So I'm gonna listen first.
Right. So, Erykah, in your presentation, you talked about Henrietta Lacks and how her HeLa cells, well, they named them HeLa cells, but her cells were taken from her during her hysterectomy when she had her hysterectomy for cervical cancer. Those cells were used to make all kinds of vaccines for polio and, like you said, billions and billions of dollars worth of help to the health industry, where she nor her family ever was able to benefit from that, despite several lawsuits. And I would like everyone, if you've not seen or heard of Henrietta Lacks, there is a movie about her life that Renee Goolsberry, that from Hamilton fame, from our own Detroit area, played in with Oprah Winfrey. So that would be a really good movie for people to watch. But I digress a little bit. But so with regard to Henrietta Lacks, with regard to the Tuskegee experiment, with regard to women being given surgery without anesthesia to actually, find out whether or not they had pain fibers, all kinds of terrible things. But that was historical. But that lends to the mistrust then, and people thinking that the COVID vaccine, they'll be given a placebo. They won't be given the correct, they won't be given adequate medication. But even the manner in which African Americans are treated when they enter the healthcare system and the healthcare arena right now is a reason for mistrust. We know that we don't get the same care that are offered to our Caucasian counterparts. And that is something that is real, and that is something that has to be stopped. So my being involved in what we call organized medicine, where we use the fact that all of us together as an entity try to work on implementing health policy, because the only way that I see that a change can be made is if the policies by which we treat people are changed. And so the actual implementation of the implicit bias training that we worked really, really hard to get Governor Whitmer to actually make a recommendation for actually starts in June. And so what that means is that anybody in Michigan that has a license to care for people, whether it's the medical assistant or the nurse or the doctor or the nurse practitioner, everyone has to undergo implicit bias training starting in June. And then they have to continue to do that on a yearly basis to maintain their license. And so, the way I see it is that is, a way of ensuring that moving forward, people will have to try to treat each other empathetically and treat the patients with the respect and the dignity that they deserve, and thereby giving them appropriate care.
Yes, absolutely. Thank you so much for sharing, because it's not just a historical thing, as you said, it's a modern thing, and it may not be the same exact type, where now it's really, that type of unethical research is not going to happen as much.
Right.
But again, that mistreatment, that implicit bias
Yeah.
is there, and I'm so grateful that you and so many other people care about that and are promoting increased implicit bias training for medical professionals.
I'm so glad you said that, Dr. Gibson, because I was struggling with this question, because I'm nursing is what I do. I'm nurses nurse. I love what I do.
Right.
So my first thing I went to, patients not trusting us, not trusting the doctors, not trusting the nurses. And just, I go into a patient and they're in the hospital and I'm telling them, oh, okay, we're going to do this, this, and this. They don't know me from anything. I just met you. I have to build that, but it's so hard to break that.
Yeah.
Because although we didn't live back when they did the Tuskegee syphilis experiment, we know about it. So that distrust has been
there for a long time.
Sure.
Yeah.
So I thank you for saying that, because that cleared that up for me for sure.
One of the things too, I think, and Dr. Gibson, you hit it right on the head when you said that, these implicit biases and so forth. Another thing that I find too is that when people of color come into the healthcare environment, and it's no fault of their own, they may not know what's wrong with them or what the issues are, but their caregivers, their provider, don't take the time to sit and talk with them.
Right.
Find out what is actually going on with this individual. They may be having a stomach pain, but the stomach pain is caused by something else.
Exactly.
The stomach.
Right.
And the first thing they want to do is shove some pills at you.
Exactly.
Do this or do the next. Let's sit down and talk with someone.
Right.
And that is one of the biggest reasons why I see African Americans. Either you come to the ED, the first thing they want to do, oh, you want some drugs for pain.
Exactly. Right.
If you have a sickle cell patient, I know Dr. Gibson, you
right
all the time, and Dr. Knight, who've dealt with, I'm sure, internal medicine patients. A sickle cell patient come to the ED, they are in crisis.
Right.
How do you treat them? Not shove them in the corner, oh, they're only here for some pain. So again, these explicit biases that are placed upon people of color all the time, and it's unacceptable. I, as a professional, go to the doctor, and immediately, don't tell me I need to take no pills. I don't need no pills.
Right.
Talk to me and tell me what is wrong. I do not want your pills.
Right.
Yeah.
Well, for me, this is a multi-layered question and a multi-layered issue.
Yes.
I live in the South. I've done most of my medical practicing in the South, and the 4 years that I was in Indiana, it's different. It's different there. So it's a little more challenging in the South, but I think that one of the biggest issues is not what goes on in the hospitals per se. Most of the issue is what goes on in the outpatient setting, and the relationship that patients develop with their primary care physician. And because what I think, one of the questions later we'll ask about how things have changed. Back when I was in medical school at Emory 28 years ago, there was no real dialogue, teaching about racial bias or anything like that.
Right.
I think they're doing more of that today in the training, but part of the problem is that you have a lot of older physicians that are in the outpatient setting, they're the physicians that drive the outpatient, and they, unfortunately still have old ways of thinking, old ways of interacting.
Yeah.
And we as Black people, we have certain fears, certain anxieties about our dealings and our interactions with these, a lot of times, older white physicians. And until that changes, and I'm glad they're starting to require more implicit bias training and things like that. But unfortunately, until there's more access that we as Black people have to younger minds, more progressive minds, it's just like what we've experienced with, like the Black Lives Matter rallies, compared to what was experienced 40 or 50 years ago with the civil rights rallies and marches. Now you have so much more engagement with the younger people, that are of other races, white, Hispanic, Asian, who are more, the younger people seem to be more sympathetic to our cause, to who we are, to the multicultural. Until some of that dies out, we have to be very intentional as Black people about pushing past how we feel, our fears and anxieties, and continuing to engage the healthcare system, knowing that things are just more transparent now, and people can't get away. People cannot get away these days with the same thing that they did even 20 years ago.
Right.
And one of the things too I've experienced too is, we as people of color are afraid sometimes to question these providers. People will call me and say, "Oh, what about this?" I said, "Listen, write all your questions down. Go to the doctor. You have a list and ask every question you think you might want answered." But a lot of them are afraid to say something to the white doctor because they fear that they're not being intelligent enough, or maybe asking the question the right way. So they don't get the answers that they actually need. So when they go for treatment, they would end up with something that they really don't need.
Right. And just one other thing I'd like to add, with that both of you all said, was people, African Americans, our African American community doesn't trust the white doctors, but they also don't trust us. And that is something that just gets me to my core. We all know how hard we study, and that we know way more than anybody that graduated with us from our medical class. But to have the community say that they don't trust us, and it gets back to what Erykah presented earlier was, people will say, well, there were Black doctors in the Tuskegee experiment and they allowed, that to happen. So I think that there's just so many layers, as Dr. Knight was saying, to this whole racism issue, and our own patients not even trusting us to give them the correct information. And I don't know what we do with that other than try to just talk and get information out. But like both of you all said, there's so many layers to what we need to get through, and just try to give our patients in our community the information, and hopefully if we just keep talking and trying to break through that barrier.
No, yes, absolutely. I completely agree. Especially like he said, it's like a wall of trust that we need to just break that wall down, so that we can actually have this flow of trust between the patient and the provider.
Exactly.
But thank you so much for sharing that. And then I'd also like to include Pastor into this discussion. Pastor, I know that you may not be a medical professional, but seeing this as somebody—
Our spiritual medicine.
Yes, spiritual medicine. What are your thoughts on this topic?
Well, again, good evening, everyone. I was thinking as the doctors were sharing about the mistrust of, again, even of ourselves. It's vitally important, the education piece, this conversation that we're having, that's why we're having the conversation, to try to dispel some of those thoughts of the fact that maybe we don't know as much as the Caucasian doctors know.
Yeah.
So
Or more. I'm sorry.
Right. We do know. We know more, right?
I'm just sharing from where I am.
Yes. Yes. Right.
As I spend time with seniors and others,
Yeah.
these are some of the statements that are being made. That, you know, this person, you know, if it's not a senior individual, they don't trust them. If they're not white, they don't trust them.
Right.
And because they don't think you know as much.
Yeah, that's a fact, Doctor.
But one of the things that I share with them is that it's my intent always to have a doctor that looks like me, because he knows some of the things that I'm going to experience in my life. And so therefore, I've made it a point to have an African-American doctor. And then when the insurance things changed and the doctor that I had couldn't go any further, I had to find another doctor. I called Dr. Gibson, say, hey, I need another Black doctor. And she was able to refer me to another. And actually, the next doctor made more progress with me than the last one.
Good.
So it's exactly what you're saying, is that you do know more.
Yeah.
You do know more. So, but that's the kind of thing that I do encounter on a regular basis, that distrust.
Right. And so one other thing, so Dr. Fauci was saying, and I've heard him state it multiple times, he does not understand why, especially because we know that less than 50% of patients of African Americans are saying that they're going to take the vaccine. And most of the studies say either 47% or 48%. But Dr. Fauci's point is, if Dr. Kizzmekia Corbett is the one who developed the vaccine, that should be front and center. Her picture should be all over the place. You shouldn't be able to open a newspaper or pick up or turn on the TV without her face being right next to the discussion of the coronavirus vaccine. But we all know why they don't want to just give credit to the African American woman scientist who actually developed it. But there again, that's another layer to what we're struggling with.
And to that point, if you go into the CDC has many, I'm sure Dr. Knight knows quite well, many areas and aspects that it's just not just focusing on the coronavirus. They do, because I myself has been there, and from time to time, and you see people of color,
right?
And look up them are there, but they are not. It's like the laboratory or anywhere where research and the development has been. It's always been in the basement somewhere or in the somewhere. They never bring them up to the first floor.
Right.
Bring them to the first floor.
Exactly, right.
See who is behind all of their medicine that is being developed for them. Right now, there's a team of Black men and women who are now looking at the treatment, the courses. Right now the treatments, it's hit and miss half the time.
Exactly.
For this virus. But guess who's behind it? We've got
absolutely.
All Black
people.
I am so proud when I see Black people.
Yes,
I stand proud. I must have.
Absolutely.
But
yes, like you said, it needs to be on everything. It needs to be on the fact that, I'm really appreciative that CBS special for featuring her, but I'd love to see her more up on the forefront, maybe even speaking on behalf of the vaccine, so that people can get the face, see the face and maybe develop that trust. So going into the next question that I had for you all, what would you say to someone who is hesitant to take the vaccine? Let's say you bump into somebody and they are hesitant to take the vaccine. What advice do you have for them?
Well, first of all, I'd show them my button. And I took the vaccine and I got both doses and I didn't have a problem. Now, and what I would also explain to them is actually what the vaccine does, because a lot of people think that when you give them the vaccine, you're actually giving them the virus itself, and that's not the case. You're giving them a particle to make their body make antibodies which fight the virus should it come into their system. I would also tell them that when you get the vaccine, any vaccine, it's going to stimulate your immune system. So it revs up your immune system, and revving up your immune system, your body may feel it. You may get tired for a couple of days. You may get a low-grade fever. You may even get a little slight headache or nausea, but that's because your immune system is doing what it's supposed to do. It's revving up and actually making appropriate antibody to that virus. I would also let them know that it's not going to make them sick. People are just, and I tend to ask people, what I would ask them why they don't want it. And that's one of the things I do with my patients, and listen, so I have my little spiel that I just gave, but talking to the person and asking them, why is it that you don't want to get the vaccine? What is it about the vaccine that you don't want? And then trying to listen to them, and then just dispelling any kind of misinformation that they had. So, that's, a couple of the ways that I would respond.
Well, that's great. Thank you so much, Dr. Gibson, because, just even understand the process of how a vaccine works, to the everyday person, like to know how a vaccine works, can help clarify and just demystify the whole process.
Yeah.
So
one of the things too I find is that, persons, like what I understood clearly what Dr. Gibson said, like the words immune or antibodies or antigen and that type of thing. The lay person do not know what those words are.
Exactly.
So you have to take your time and take out antibodies and say, okay, find a word that they understand, especially African American people. We have a tendency,
right?
Big terms that go right over their head.
Exactly.
You have to find a way to make them understand what one does and what one doesn't do.
Right.
When you start talking, oh, this site that has this allele on this and
exactly right.
So
right.
you have to be able to bring it down to, like, we all know, communicate at an 8th grade level so people can understand.
Right.
And
yes.
Don't fool yourself and think it's African American just alone,
Oh, exactly. Right.
No. The Caucasian nation don't understand.
Exactly.
Explain to them.
Exactly.
Too.
Right.
You know, they just confess and believe, right?
Right.
Sharonda, they confess and believe that they, know, but they don't.
Right. Right.
And they too.
Right. And then the other thing is, okay, so are you going to not get the vaccine and risk getting the coronavirus yourself, or giving the coronavirus to somebody that you love or somebody that you don't even know, and risking them dying? Yes. 400,000 people are dead in our country. That's insane. My little 5-year-old Skylar Herbert, who I delivered, her mom, Lavandria, was my dad's patient until my dad retired. And then she became my patient, waited till she was 41 to have a child. And then she was in my office with her mom for her GYN. Her mother was there for her GYN exam in February. She gave me the cutest picture. She loved to dance. So she gave me a picture of her in her dance outfit. And then 2 months later, she's dead of coronavirus meningitis, a 5-year-old. And so I, in my faith, understand that Skylar is with the Lord. What breaks me up, and I can hardly talk about it right now, is her mom in the bed wailing because her child is no longer gone, holding that blanket. So it's the other portion of it is that we got to get people to realize people are dying. Do you know what I'm saying? It's a life or death. It's not like some sniffle. And the manner in which people die, Pastor, I think, was talking about this earlier. They die without anybody around them. You know what I'm saying? No family members, you know, and then the family can't like do proper send off and homegoing. I mean, it's just, you know, it's just, we gotta just say a little, you know, vaccine versus coronavirus and death. And the other thing that I like to share is that even if you don't end up on the ventilator in the hospital, we're finding people are having lasting effects from actually just having the coronavirus. So you know, some neurologic issues, blood clots, heart problems. And the other thing I wanted to bring up is pregnant women, because pregnant and or lactating women, meaning they're breastfeeding. You know, we definitely want everybody basically to get the vaccine, because we've seen in some moms that have been positive when they delivered their baby effects in the infants in their lungs. So you know, that's, you know, when we get, you know, more into it, you know, it's like it's, you know, death, illness, sickness versus a vaccine that's gonna, you know, just give you some discomfort. There is while I'm talking about this, you know, so people who have allergic reactions, or, you know, you've heard them talk about anaphylaxis, those patients generally can still get the vaccine, but we do it in a hospital setting, so that if they do have an allergic reaction, they either get the Benadryl or they, you know, get an IV, you know, to stop the allergic reaction. But there haven't been really too many anaphylactic responses, new ones. You know, people, there's a couple of people who have had a history of anaphylaxis and then they got it again, but.
Dr. Knight, can you share something with all of us, but mainly I want to get a response that I can give to Black men.
Oh, good.
Very sure. I was actually a math major in undergrad, and a lot of medicine to me is all about the numbers. And when I'm talking to anybody, really, but particularly Blacks, about the vaccine and about doing the things, wearing the mask, social distancing, washing your hands, good hand hygiene, I just give them the numbers, and the numbers are basically this: one out of 40 Blacks that get the coronavirus will die.
Right.
That's the number.
Right.
And you can say millions of people have gotten the vaccine, and that I don't know if anyone's died from the vaccine. Maybe there's been a couple deaths from these reactions, allergic reactions, but 1 or 2 out of millions, and that's your risk, versus 1 out of 40. Do you really want to take that risk of being that one person in 40? And this isn't just older people. This isn't just people with other conditions that increase your risk of having a bad outcome. This is everybody. This is children up. And so that's what I tell people who have hesitancy about, particularly Blacks. And it's not much better for whites. It's still 1 out of 100. So regardless of who I speak to. So it's really just, do you want to take that big of a chance and not only potentially dying from it or having long-lasting effects from it, but getting it and probably the worst thing that I could do is get it and not know it and pass it on to my 81-year-old parents who've been married for 62 years.
Yes.
Exactly.
And they die from it.
Right. Yes. That's what sorry, you could sorry, I was just gonna say that last piece there. It's like to unknowingly infect somebody who you may survive, you know, getting COVID, but somebody close to you may not. And I think that really is the piece there, to be responsible, you know, to be responsible about how you may impact others. I think that that's the key there. That's one of the biggest lessons from this pandemic too, is that people don't want to wear masks. They're like, oh, I'm not going to get sick, but no, you can get other people sick.
Right.
One of the other things too, I find too that what is happening is that persons, because there are so many conspiracy theorists out there, you know, telling you all these things. Oh, because the virus, this vaccine was developed so fast. No, it wasn't.
No, right.
This thing has been around. I don't know if you paid attention to what the
Dr. Corbett, yeah.
Dr. Corbett was saying. She started, the platform was there 6 years ago.
Yes.
So people are suspicious of all of these things. Okay, you've taken the polio vaccine, you've taken the MMR, you've taken all these other vaccines. So why not this one? It's no
right.
Absolutely.
So the suspicion of all of these conspiracy of because of this group and they're trying to kill Black people. That's why you have persons are not actually standing and taking those viruses.
Right. A vaccine. And then one other thing, so you know, I don't know that any African American person that wouldn't want to take care of our children. And both the Moderna and the Pfizer vaccine, they're all for 16 and up and 18 and up. So the way that you get what they call herd immunity, which is the immunity in a community, so that the actual virus does not spread and other people don't get it, is to vaccinate. You've heard people talk about at least 75 to 80% of a community needs to be vaccinated. So we basically say 75 to 80% of the United States needs to be vaccinated so that a person that comes into that community with the actual virus can't spread it. And because we can't give the vaccine to our children 16 and under, we owe it to ourselves as well to protect them from us spreading the virus to them.
Mm-hmm.
Yes,
absolutely. Well, thank you so much for providing all that information.
Just started the testings on children under 16, so they're now going through that trial now, which is good, and parents are volunteering their children to in these drug trials.
Yes. And then I have one last question, and then we're going to turn it over to the audience. We already have a few text questions in the discussion, so let me go quickly. So this is actually on a personal note. So, and I'd love to have your experience as medical professionals. How has working during this pandemic impacted you on an emotional level, given what you have experienced?
For me, in the beginning,
no smiles. I see you smiling.
So difficult. It was very, very difficult for me because going into work, we were walking into something that was unknown. And things were changing day to day, minute by minute. Like one day they say, oh, you don't need to wear a mask. The next day, oh, you absolutely have to wear a mask. And it's like, you didn't know what was what. And we went from being able to just come and go as you please, being free, to me speaking to my parents through a window. So it really, it's still like it's a mental trip for me. And it's like many days, many nights, I have to make myself get up and say, listen, this is what I put you here to do. Because some people say, oh, if it gets too bad, don't go to work. I can't. This is what I'm here to do. This is my ministry. I can't just give up. But it frustrates me when I see people who don't take it serious. They don't understand, and they wait till it hits their house, till it's like, oh, it's real. It's been real. It shouldn't take for your loved one to die for you to say, oh, this is real. It is real. Please take heed. I get frustrated on social media just looking at people I understand. I want to get out and I want to do things, but you know, at this time, you just can't do it. You have to take responsibility for you, and you have to take responsibility for other people, because some people are just out and doing whatever they want to do. But at the end of the day, I know who keeps me, who has kept my family since March until now, who's going to continue to keep me and my family. It's God. It's just God who has kept me this far. It gets hard, but I know who has me. He covers me. He covers my family, and that's just how I made it. And this how we're gonna make it into the future. So, yeah.
Right. So for me, it really affected me. I couldn't see my patients for April, May, June. I do women's health care. So women who had their appointments scheduled for their annual GYN exams, we had to cancel all of April, all of May, all of June, and then put them on top of July, August, September, so that if someone calls to make an appointment, we're still in that phase. It's like 3 or 4 months out, which I think is just doesn't make any sense. I understand why it happened, but it happened. Couldn't do surgery, had to cancel. People who had necessary surgery scheduled, while at the same time trying to take care of emergencies. But the main thing is that really gets to me is like every day I get like a notice from a family member,
Can you hear
or
me,
I
Erykah?
look and somebody has passed away. So, or either the patient will come in and tell me their mom or their daughter or their son or a father or a grandfather or grandmother has passed. So it's a lot, which is, why I appreciate pastors' prayers.
Yeah.
Thank you.
For me,
Absolutely. And what I wanted to say, hello?
Yes, I can hear you.
What I wanted to say is, what I found, I was affected by the virus. I was very, very sick. I was in the hospital for like 2 weeks, but thanks be to God, I am a recoverer.
Yes.
And according to my physicians, I'm almost 100%, which is a blessing in itself.
Definitely.
But as Sharonda said, it so much aggravates me for people to think that this is not real. They're telling you every day, this many people have died. They're telling you this many people have been infected or affected with the virus, and you still run around talking about, well, I don't think it's real. I think it's a hoax. I had a situation the other day where patient came out the room. He didn't have his mask on. I was like, excuse me, sir, you're not supposed to be walking around with that mask on. And he says, I told him, excuse me, you're going to need to go back in that room and put that mask on.
Right.
I said, or whatever it is that you're asking for will be denied. You need to know that. So he went back in the room, put the mask on, bumbling and grumbling. But my point was, and y'all know who I am, so you know what I really wanted to say to him. But my point was, we still don't know what you got. If you don't get yourself back in that room, and yes, they do the rapid tests. Sometimes those tests are not accurate.
Right.
It takes them 2-3 days to find out,
right,
if you are actually affected or infected. I've been in fact, the way that I was affected, went into the room to do an assessment on a patient. The patient in the B bed was coughing. Me and the nurse and the social worker.
Right, both.
We're all looking at each other like, we probably need to get out of here. So we leave.
Right.
So the next day, they test the patient that was in the B bed that's still coughing. They test her. I came back on the unit. She's in the positive pressure room. I'm like,
oh Jesus. All right.
But at that time, by then, the social worker is showing signs of illness. The nurse is showing signs of illness.
Yeah.
And by the end of that week, I was sick.
Right.
So
wow.
It really, really aggravates me to no end that people do not believe. And that is Black and white people. It doesn't really matter. I see the young kids out. There was a couple guys out walking down the street, walking past the gas station one day, and I was pumping gas, and the young man looked at me. Of course, I had my mask on, and he looked at me, and I said, "Where's your mask?" And he pulled the mask out of his pocket. So if you got the mask, it does you no good in your pocket. Why do you have it in your pocket when you know it should be on your face?
Right.
But that to me, yes, Sharonda, I understand fully. It's a struggle for me every day. When I finally was allowed to go back to work, I had specific instructions as to where I could and could not go and who I could and could not see. And I still do my mask, sometimes double mask, wear my goggles or whatever protective equipment we need to wear. But it is just so mind-boggling to me how many people still almost a year out, don't believe that this thing is real.
That's true.
And as far as the vaccine is concerned, I have had many conversations with many people, be they black and white. The black folks saying, well, they had that Tuskegee experiment. I said, excuse me, let me tell you one thing. They're giving the vaccine to everybody.
Right.
They are just not singling out black people to give the vaccine to, or people of color. They're giving it to everyone. And if they're giving it to everyone, it can't be all bad. If they were trying to annihilate you, they'd find another way, but this not through the vaccine. That's protecting you from something that could kill you. I say the decision is, do you want to die? Do you want to die by yourself? Do you want to die without your loved ones? It's a horrible, horrible thing. It's horrible. And I see it every single day. So I just try to share with them the outcome if you decide you don't want to take the virus. And like Dr. Gibson said, you might have a couple of symptoms here and there, but that's only your robust response to the vaccine that you receive. That your body is doing exactly what it is supposed to do. It is helping you to protect yourself and others around you.
Yes.
Okay, that's my
Absolutely.
soapbox. I'm done.
No, thank you so much.
I think for me, being most of you all see the live patients. I see the ones stretch out. So I see more of the corpse. And one of the things that it was almost shell shocking for me, traveling to New York this past year, trying to identify, do tissue samplings, take pieces, take tissues and I had to don my whole garb and get into a cooler, a 40-foot cooler, 40-foot coolers to get identification, proper typing and identification on people. Nothing's worse than seeing all these people. It was each body.
Yes.
And
Oh
if somebody could show somebody that.
Yes.
This is what you're gonna look like in here. Ashton and gray and look, like a prune. If you don't do what is necessary. So for me, I saw the other side when the patient was gone. Dead. And the thing it is, the families then, they're saying we want our loved one's body. And the hospitals and facilities really hire a whole group of people to sort of dole out bodies. I'm sure they got the wrong bodies. I am sure.
Jesus.
And that's the sad part. Because you have so many people dying. Hospital morgues are built for 10 people, maybe.
Yeah.
Right.
So things like that, I think, for me, was a whole new. It was a different.
Yes, absolutely. I didn't even think of that point.
Yes,
absolutely.
That was horrible. And where I am now, I was seconded to some small rural hospitals in South Carolina. Y'all pray for me. Dr. Manny, pray for me, yeah? Y'all going in big trouble. It is unbelievable that in this day and age, when we tell you don't do that, I don't understand what you're meaning. And they're dying by the droves.
Yes.
The rural areas are worse than the cities. And people are not paying attention to that. They're dying alone, most of them.
And just one other thing, while she was speaking, it's people are wondering, like, and some people think that if they had the coronavirus anytime between March and now, that they may have antibodies and produced, and they don't have to take the vaccine. But we must remember that the life cycle of a virus is to change itself, so 14, 15, 16 times. So what we've been here, and so what that is you have a mutation that then changes the strain of the virus or the variant. So that's what you've been hearing about lately, that there's another, it's like the 15th or 16th mutation that's caused a variant or another strain. Like Dr. Butler tells me, speak so that people can understand. So the mutation in the virus is a change in the mRNA that change causes what we call the variant or a different strain.
Yeah.
But so there have been all those strains. So just because you had one strain of it doesn't mean that you can't catch the other ones. So that's why everybody, whether or not you've had a positive COVID test or not, everyone still needs to take the vaccine.
Okay.
Oh, you experts are so great because you actually covering all of the questions that you can't see that are coming in on Facebook. We are live on Facebook right now, and so we want to give Facebook a shout out just a moment because we have some questions that have been coming in, and we Dr. Gibson, you just answered one of them. Someone did say, if I had COVID, do I have to get the vaccine?
Yes.
You covered that.
Buddy.
One of the other questions for the panel is, Sister Edna said, if a person is allergic to penicillin, is the vaccine safe? And then also, if you're a cancer patient, would you be getting the vaccine too right now if you're in cancer treatment? And then also one last one I just want to throw out there for the panel. You think it's going to be an annual vaccine?
Okay, so all of those are good questions. If you have a penicillin allergy, yes, you can still get the vaccine. Penicillin allergy does not affect you getting the vaccine. Cancer patients are what we call immune compromised, and you definitely want that person to get the vaccine because the COVID disease in the person with cancer will be devastating. And I just want people to understand the coronavirus is the name of the virus that causes COVID, which is the disease. So the CO stands for corona, VI virus, D disease, -19 is the year that it was developed, November of 2019, just so that everybody's on the same page. And I'm taking a note from Dr. Butler on my explanation. So
thank you.
Thank you very much, Dr. Gibson.
And there was a third thing you had asked. What was the third one?
Do you think the vaccine is going to be an annual vaccine?
Okay, so we don't know that yet. So we have to follow the science. And I don't know if anybody, if you can see my card, I don't know how to do this. Anyway, so when you get your vaccination, you get everybody gets a vaccination record, and it has your doses on it. It has the lot number of the vaccine that you were given. So that's how you know it's not a placebo, because the lot number of the actual vaccine that you got is there. But there's a thing called V-Safe. So everybody that gets the vaccine is encouraged to log on to V-Safe. And what that does is that follows you. So they have you on a database, and they're asking you, after each injection that you get like a daily or every other day a query about how you're feeling, and there's a series of things, and it goes really fast, and it comes on your cell phone, and you just check it off. So they're following those things. Right now, we don't know because we're just giving it. It may be possible that years down the road we might have to have a booster, but we're not sure. So the answer is we don't know whether or not it's going to have to be given yearly. The thought is no, but we don't have a real answer to that. And we're just going to have to follow everybody that's been given the vaccine to see how long the immunity lasts.
Yes. Thank you, Dr. I'm really glad that you said that we need to follow the science. I think that's really a great point there because the essence of science is that it's always evolving. There's always going to be new information. Because I remember a lot, the main argument that a lot of people who are anti-mask wearing say that at the beginning of very beginning of the pandemic, if you remember Dr. Fauci saying masks aren't as important because there's a shortage of
that was our Surgeon General. That was
our Surgeon General. He said that because there's a mask shortage, that's not going to be as important. But then they switched back and said actually everybody should wear a mask.
Right.
And everybody started doubting. Oh wait, why did they start telling us a different thing? And I remember it's like you have to follow the science. People find new information, and you have to be up to date.
Right, because you remember we were just learning about it, and his point was what was happening was masks were going up just like the toilet paper. So masks, doctor, so his point was that the masks were going away, and you needed the mask for the people in the hospital until we got our stores, and then it got clouded. Dr. Jerome Adams, African-American Surgeon General. And he got a lot of flack for that, but Erykah makes an excellent point that it's evolving. Everything that we know about this virus and the vaccine is evolving.
And to that point, again, I heard a teacher trying to, well, not trying, she did a very good job explaining to the children how the vaccine has come about and how it metamorphoses and how it changes.
Yes.
Now, children were like, what is that big word? So what she did is she showed them a larva and how it becomes a butterfly.
Exactly, right.
In itself made them understand what was happening.
Exactly.
How it's changing.
Yes.
Right now, there's about 4 strains right now, new strains. South Africa has one, Brazil one, and then of course the English one and the one here. So these strains now, the thought is again, follow the science, that the vaccine is developed against them. And another thing people, I think folks need to know, that COVID has been, that's part of a group of organisms for
years. Yeah, right.
And you remember, if people remember, the SARS, we had SARS.
Exactly.
15 years ago.
Exactly.
So here again, you see changes.
Exactly.
So this is why we need to educate people, educate persons using what I say the dummy down language to an 8th grade level so people can understand. This has been here before. Now it came back something else.
Yes.
And we just the world was not prepared for this.
And Dr. Butler, what you're saying, that's exactly why it wasn't rushed, right? It wasn't rushed because it's been studied before. So people, one of the reasons they're saying they don't want to get the vaccine is because it was rushed, but it was not. We have information.
Yes, it's been here. That's why it was so, when they said, oh yeah, we're going to do warp speed. No, it wasn't no warp speed.
Right.
That base was here a long time.
Exactly.
Right.
That was your buddy that we don't have to worry about anymore. Lord Jesus. Yes.
Well, thank you so much for all of your expertise on this topic. And I'm so glad that we have people from so many different areas, perspectives, and expertise. I have 2 last questions, and hopefully, one of which Dr. Knight can jump in with his expertise in relation to the CDC. I have a question here saying that, do you think the vaccine can be made, could be made mandatory for work, school, and travel in the future?
Well, just like any vaccine, certain vaccines are required for children to go to school, depending on what type of job you have. Certain vaccines are required. A lot of times there are options to opt out for religious reasons or different reasons, but it's definitely gonna be something that I can say is going to be required in some aspects of work, of travel.
Yes.
So yeah, definitely we need to be prepared for that. One thing that I want to just make very clear, that the vaccine is great, and the more people we get vaccinated, the better to reach that herd immunity, as the other doctor was talking about. But the one thing that I want to
Absolutely.
Absolutely.
Masks,
Keep that
social
mask on.
distancing, and washing your hands.
Yes.
My experience over the past year has been a little different than most because I work mostly from home.
Yeah.
But the thing that I do, the reason that this hasn't emotionally bothered me much is wherever I go, I make sure that I have not just a mask, but a KN95 or N95 mask, because these are the only masks that, if worn properly, will really truly prevent you from getting COVID-19. The other masks, all the cloth masks, they help prevent you from spreading it if you have it. But this is the only these are the only type masks, the KN95
that
and
prevent
the
you from
N95.
inhaling. Yeah.
And they cost a little more money, but I encourage everybody, make sure you have a KN95. Buy it for people for their birthday. I bought them for my parents, for when they go in. When they go to church, because they've gone back to church. So my dad doesn't, but my mom does. My dad, but I've trained her, and I've trained him on, this is a mask that you wear when you're out. When if people want to come and visit, which they don't hardly let us come and visit, so you make sure you give them a surgical mask or something. But I have, my wife had COVID-19 back in May, because her job has her around a lot of people. She contracted it, but because I wore my mask and had her wear her mask in the house, I didn't get it. The children didn't get it. So if you take care and do the right things with wearing your mask, with socially distancing 6 feet, not spending more than 15 minutes with anybody. And if you see someone and you're out and people look sick, they're coughing, just like I tell my kids, don't run to trouble, run from trouble.
Yes.
Exactly.
And Dr. Knight, I just wanted to add, and wear that mask properly, have your nose covered, because you see some people with it like but have to have the nose covered, and the mouth. And then one other thing, so I think people might have heard that the COVID, the disease is higher in African Americans, but what Dr. Knight just said to me brought this to mind. So just so that people understand, the reasons that the coronavirus is higher in us is, number one, the jobs we work. The fact that the jobs we work don't really allow us to have the ability to work from home. That ability to work from home is limited in the jobs that we have. The types of, the homes, what's going on in a lot of our older homes. And then, of course, we tend to have, higher incidence of high blood pressure, diabetes, which is, I always like to say, this is one thing that I always like to tell people, and we didn't touch on this, but we need to touch on how this has affected us mentally and affected our mental health as well as our physical health. So just by making sure that people are getting adequate amount of exercise will decrease your incidence of high blood pressure, diabetes. Between 15 and 30 minutes, you actually burn fat, but also between 15 and 30 minutes, you secrete substances from the brain called endorphins that make you feel good. Those endorphins are what in drugs, but the Lord put the endorphins in our body, and they're secreted between 15 and 30 minutes, and we don't have to take the drugs. But those endorphins only hang around for 24 hours. Therefore, you need to do your exercise 30 minutes every day. I got that in there.
Yes. No, thank you, Vince. Thank you so much. Well, I would like to wrap up our conversation for the sake of time. But first of all, before we go into the last kind of the wrap-up question I'd like to conclude with our meeting, is first to thank you all, first of all, so much for donating the time out of your busy schedules to be a part of this conversation and all of the information that you have addressed tonight. And in addition to that, just thank you so much as healthcare workers for the important work that you do. I think we don't thank you enough for the work that you do in all different aspects of your positions. And I just like to thank you so much for everything that you do and the self-sacrifice that it takes to be a part, to do the work that you do.
Yeah.
Yes, and so my final question is actually in relation to the charge that Pastor Minnick has given to us this year. So Pastor has given us the charge in 2021 to get ready for good trouble. So if you could think about one takeaway from tonight's meeting, what is one thing that you can leave with us to turn this all into action?
So I would say some of the good trouble is what I think Gloria mentioned, when you have to just encourage other people to do the right thing. And what Dr. Knight brought up is so important. The basics of preventing this from spreading right now is the mask, social distancing, staying 6 feet away from people, decreasing your congregant, and then washing your hands, just basic stuff. And then, but the good trouble is if you see somebody and they don't have the mask, say something. You know what I'm saying? And so that's kind of like you might get, all kinds of repercussions from it. Hopefully it, won't be anything physical, but for me, what Gloria and Dr. Knight were saying is imperative. We have to wear that mask. We have to wash our hands, and we have to stay socially distant right now from other people until we can get 8%
For me, what I think is one of the important elements to what you all were saying just now is educate yourself.
Yes, absolutely.
Internet, who playing where, who doing what, and who going where. All this stuff is on the internet, and it's
exactly.
So educating oneself.
Yes.
What is best for you?
Right.
And that's most important. I feel one thing is education, along with the hand washing and so.
Exactly. Right. But you're right.
And be careful what go between these two things you call your ears, because we listen to all of these other conspiracy theories, and this one said, well, like we say, follow the science.
Right. And Pastor has a lot of good things on the website. So the Mount Pleasant website has a lot of good information.
Yes.
And it's places like the church, even though we're a social distance and on the whatever, that is the place where the same type of education is. And I applaud Pastor Minnick for coming up with something like this to educate his parishioners and his persons on what is out there. And don't sit like, this thing, this is gonna go away. This is not going away.
Right.
Right.
I applaud Pastor Minnick.
Yay, Pastor Minnick.
Yay, Pastor Minnick.
Woo-woo. My good friend.
Yes.
Yeah, I think good trouble for me first starts at home with your loved ones and your extended family, and making sure that they're doing the things that they need to do to stay healthy and be healthy. But then finding a way to extend that outside of your immediate family and extended family into your organizations, and just encouraging people, hey, do you want to be, would you like to take the risk, continue to take the risk of being that 1 in 40 Blacks that die when they get this, when they get the coronavirus? Or, go ahead and get the vaccine. Just get the vaccine, and then just, again, encourage us to do the other things that we need to do. And I think it's going to get worse for a while.
Yes,
still,
unfortunately.
We've got to get to a place where people are doing the things that they need to get to do. But if we all, come together and we all do the right thing, if we can all do the right thing for a month, we can wipe this thing out. So
Yes, right.
Right.
Absolutely.
Yes, agreed.
Absolutely.
Yes. And if we can do it for a month, it becomes a habit.
Exactly, right?
Yes.
Like, hand washing is a good idea, right?
Yeah, yeah. And it was so interesting to me because I was like, so all this time you guys haven't been washing your hands? What you been doing?
Right. Like, exactly.
Right, right.
Right. Well, I thank you all so much for being on this call tonight. Before we before we get off for the night, does anyone have any last minute comments or anything? Just make sure that I'm not missing anybody.
Well, Erykah, I do. I just really would like to congratulate you. The manner in which you presented this topic, this important life-saving topic, is just awesome. And so I just would like to
Thank you.
Absolutely. Awesome job, Erykah.
Thank you so much.
And
Thank you so
where's
much.
is Dr. Erykah? Is she still there? She held down the Facebook for us.
Yes.
Reverend Erykah, yes.
Yes, I'm here. Thank you. Thank you all for doing this. This is awesome. We're getting a lot of shout outs on Facebook. They're loving it. They're loving it. Thank you.
Well, that's great. Well, let's wrap up and close out. And I'd just like to thank you all so much for attending tonight's event. And thank you so much for the perspective, expertise, and experiences. Exactly why I invited you all tonight, because I knew that you would provide all of this wonderful information.
Let's do it again.
All right. Yes, absolutely.
Yes.
Good night, everybody.
Good night.
Good night.
Bye, Pastor Minnick. Be sure.
Bye. See you all later.
Bye, Pastor.
Thank
Bye-bye.
you.